I am happy to entertain any kind of questions or any comments. And I will give you this microphone and go back to my stationary microphone.
Firstly, thank you for coming to Rhode Island.
It's great to be here.
Thank you for your energy and
coffee.
Thank you for writing a book that's so accessible that all of us can understand what you did. I happen to have lived in Woburn, Massachusetts in the early 1980s in the midst of the childhood leukemia epidemic there that was also based on toxic waste issues. A lot of what you tell in your book is so inspiring and so hopeful, but one of the things that for me was profoundly sad was the degree to which the opposition and the organized dismissal of your work was so recognizable from the things that people went through in the early 1980s, late 70s and early 80s. Not just a community that didn't want to believe that something bad could be happening, but politicians who had vested interest in thwarting research, corporate interests that had economic interests in disabling protection for families and children, and a societal situation where our commitments were so focused on pretending that what's happening isn't happening. That it was, well, my question is this. What has got to happen for this to stop happening? 35 years ago, 40 years ago in Woburn, the same things that you encountered contributed to the death of a couple dozen kids from childhood leukemia. What has to happen to make it stop?
So the short answer is we have to vote. That's what has to happen. We have to vote for folks who espouse the protection of public health and children's health and see their work in the life course trajectory of a child, not the trajectory of their term in office. You know, you turn on the news right now and it's almost as if we're at war with our children. We have one of the highest child poverty rates of any country. Our inaction on gun violence literally makes schools war zones. Climate change will make catastrophic the world our children and their children will live in. Constant threats to programs that kids need, like WIC and CHIP and SNAP and Medicaid, the potential loss of the ACA, the dismantling of the EPA and regulations that protect our it's okay, I'm going to stop because this is really depressing. So you know, you just have to open your eyes a little to realize that we are not a nation that protects children. Yeah. Our policies have not been endearing to our kids. Why? Like, why? And I've thought about this a lot. This is literally what keeps me up at night. Like, why? Is it because kids can't vote? Like, maybe if they were an electorate, we'd pay more attention to them. So now there's efforts to lower voting ages. Like, I think Tacoma Park and in Maryland, Washington, D.C., other places are looking at lowering the voting age to 16. Yeah. That would be, my 12-year-old should vote too. Or, you know, there's also something called proxy voting, called demony voting, where parents get like a half vote for kids. I mean, I think that's one possible solution, is how do we elevate the voices of children and what their needs are. But, you know, I talk about in the book, like, you know, people are like, I thought you were going to blame the, you know, who were the villains in this book. And the villains in the story, just like in many of these stories, are kind of the long-standing issues of capitalism and greed and racism and austerity. So, you know, those are the values that drove this story and many other stories. You know, your story 30 years ago it repeats all the time. I talk in this book at length about kind of my historical heroes in public health, and I think my biggest hero is a woman named Alice Hamilton, who fought General Motors in the 1920s to not put lead in gasoline. And she was this incredible scientist. She was the foremost expert on lead poisoning in the 1920s. 1920s. We think we hear a lot about lead now. It's the most well-studied neurotoxin known. Like, we've been knowing about its evil for a long time. And General Motors knew it was evil, and they knew they had alternatives, but they had a patent on lead and gasoline, on tetraethyl lead, and they made money off it. Yet it hurt more children, in the world than any other kind of application of lead. So this story repeats and repeats and repeats. And I think, I think great things are happening at the local and state levels that are not happening now at the federal level, and that's been really, really reassuring. We're seeing a lot of kind of inspiration and models that are being built locally that we need to hopefully then kind of elevate and translate. But this story continues to repeat, and we need to keep our eyes open. We need to keep our eyes open to that history, which continues to repeat. The attacks on my science are actually, they continue. We are very much in this climate right now of science denial, be it climate change or vaccines, and even now we've seen a resurgence of lead deniers, driven by the lead industry and their lawyers, who are trying to even downplay what happened in Flint, but also nationally, because they don't want the regulations to be strengthened. So this continues to date.